Hi, my name is Lauren, and we did our project on diabetes in the heart. Diabetes is a metabolism disorder that affects the way the body takes food and turns it into energy. The body breaks down the majority of our food into glucose, which is used as fuel for cells. Insulin, a hormone produced in the pancreas, then helps the glucose move into the cells. A normal pancreas produces the correct amount of insulin. However, when the pancreas produces too little insulin, or if the cells improperly use the insulin, then diabetes results. Therefore, the glucose levels steadily increase in the body while the cells are starving for energy. If left untreated, then this high blood glucose level will damage the nerve cells as well as the blood vessels and will ultimately cause different heart conditions. As you can see in this picture, first the stomach changes the food into glucose, which is used as fuel for the cells, and then step 2, the glucose enters the bloodstream, and step 3, this is the pancreas that makes too little insulin in someone who has diabetes. Therefore, the glucose will build up in the bloodstream, causing a variety of different problems. There are 2 main types of diabetes, and we're going to be talking about type 1 and type 2. Type 1 diabetes results from an autoimmune reaction in which the body attacks its own insulin-producing cells. Therefore, people with type 1 diabetes produce little to no insulin and have to have daily insulin injections to normalize their blood glucose levels. This typically occurs in children or young adults. Type 2 diabetes, unlike type 1, is not dependent on insulin. Also, 90% of diabetes cases are considered to be type 2 diabetes. People with type 2 diabetes are considered to be insulin deficient or insulin resistant. Also, type 2 diabetes is typically diagnosed in patients that are at least 40 years old. While type 2 can remain undetected, after blood test or glucose test, type 2 diabetes is typically diagnosed. And as you can see, type 2 diabetes is also associated with an unhealthy lifestyle or people who are obese. And now Eric is going to talk about atherosclerosis.
People with diabetes have increased blood glucose levels, which can cause damage to nerves and blood cells. This in turn can lead to cardiovascular complications, for example, atherosclerosis. Atherosclerosis is when the arteries harden due to buildup of fat and cholesterol, which form on the lines of the arterial walls. Here we can see the arteries of a normal person, which has no buildup and the heart can easily pump blood through. Underneath we have an artery with atherosclerosis, and we can see here how it's a lot narrower of a path for the heart to pump blood through. So when a person with atherosclerosis gets a blood clot, the heart has a lot harder time pumping the blood through, and it adds a lot of strain to the heart, which can lead to heart failure and heart complications. Next, Vivek will talk about a supporting study.
This is a study by the Finnish Heart Research Foundation. It was a cross-sectional study over 7 years with type 2 diabetes patients and non-diabetic patients, both with and without prior history of MI. What the study revealed was that both had very similar incidences of MI and both had very similar mortality rates. The incidence of MI was the incidence of MI only differed by 1.4%, and the mortality rates only differed by 0.4%. So this chart shows the results of the study, and the 2 middle lines, which is the diabetics without prior history of MI and the non-diabetics with prior MI, and you can see that they both had very similar mortality rates over 7 years. The last one, the red one, is diabetic patients without prior MI, and as you can see, they had the lowest mortality rates. And the study also found that the bottom group had a 26% higher chance of having MI versus non-diabetic patients with MI. So we can clearly see that diabetes progresses the cardiovascular events leading to heart problems. And next we have Elizabeth with cholesterol and diabetes.
In general, cholesterol is an essential fat in the human body. However, it's not soluble in the blood. Therefore, it has to be transported through the bloodstream by lipoproteins. There are 2 types of lipoproteins: HDLs, high-density lipoproteins, and LDLs, low-density lipoproteins. HDLs are considered good cholesterol because they transport the LDLs, the bad cholesterol, through the bloodstream. LDLs have a tendency to stick to the arterial walls and attract fats and cholesterols, forming plaque. This plaque formation and buildup can lead to atherosclerosis. Diabetics have too many LDLs and too few HDLs. Therefore, this increased level of LDLs in the bloodstream causes increased fat deposition and increased plaque buildup. Also, diabetics also have too much sugar or glucose in the bloodstream. This excess glucose causes the LDLs to slow down in the circulation of the bloodstream and further increase the plaque formation and buildup. This plaque buildup causes a hardening of the artery walls and it contributes to arteriosclerosis.
Hi, I'm Lahari. We found a supporting study in the Diabetes Care Journal which assessed the risk of subclinical coronary artery atherosclerosis in subjects with normal glucose tolerance, impaired glucose tolerance, and also subjects with diabetes, either type 2 diabetes that was diagnosed or OGTT detected diabetes. OGTT is the oral glucose tolerance test that the researchers used to test whether the patients that did not have diabetes diagnosed had whether they had either impaired glucose tolerance or whether they had even the more severe OGTT detected diabetes. Now onto the graph. We can see now in the part sectioned off in the red that the median CAC score, which stands for coronary artery calcium score, which measures the calcium deposits in the coronary arteries, that in the patients that have impaired glucose tolerance, their CAC score is significantly higher than people with normal glucose tolerance. And then as we progress in the graph, we can see that the patients with OGTT detected diabetes have an even higher CAC score, and then the diagnosed diabetes patients have the highest CACC score. And then to conclude in this data,
So what is this all about? What does this have to do with you? Well, it has to do with keeping you healthy, avoiding having diabetes, and therefore avoiding atherosclerosis and any other heart condition that you could possibly have or that can be increased from having diabetes. So what causes all of this? Well, not eating healthy, not exercising, just generally living an unhealthy lifestyle. So we have a few tips to keep you healthy and out of the hospital. Maintain a healthy body weight, low fat, high fiber, high protein diet, be physically active, avoid smoking and substantial weight gain, and observe and practice an overall balanced and healthy lifestyle. So don't take the bus, walk to class. Don't eat a donut, have some carrots. Anything you think, little replacements, drink more water than soda. All of these things are good for you and will keep you out of the hospital and out of having heart attacks. So, thank you.